And here it's just knowing that an islet, specially stained here, is mostly these. 70–80% beta cells. Those light pink cells are betas. These are alphas, no ID. Even got a delta over here, another no ID. As far as you're concerned, continuing on the pancreas, now we isolate on the islets as the endocrine part, which are mostly beta cells. And then we're just setting up for a discussion in this area for the lecture. Talk about what those three cell types do in your glucose control. Two things for this tissue. Ink spots always tell you it's pineal gland, and that these ink spots are actually crystals that are precipitating in the tissue, known as acervuli. If you're desperate, try brain sand. You might get a point. I would prefer the technical name, acervuli, or if you wanted, CaCO3, calcium carbonate crystals, actually telling me what they're made of. So brain sand is a little too soft. That's all I need. Ink spots telling you it's pineal, and then the spots are actually crystals known as acervuli. Clinically used as a radio-dense spot on X-rays, CTs. And then our other orphan of the system. Now to get a younger individual, heart, lungs, and yet draped over the heart is this glandular blanket. There's the thymus. It's a perfect specimen. And that you're seeing a mass of lymphocytes in which you're getting conferred a sense of cellular self. So they recognize you and then go after any alien material or invading microbes. Trachea right there, normal thyroid draped over right there. And yet in all of us right now, that's a little lump of fat sitting on top of the heart, not the heart, usually just below the arch of the aorta. It's completely normal to have that little fat remaining after the thymus has been fulfilled in its requirements for conferring a sense of self. And then lastly, I need you to be aware of the odd structure within the thymus, this little ball of cells. What is a Hassel's or a thymic corpuscle? They're actually epithelial cells in a little ball. And these are another histological mystery. What's going on with Hassel's corpuscles amongst those lymphocytes? Another part of one there. Another question mark for function of the corpuscles. All right. Down the home stretch from last week. This was the young specimen showing the urinary structures. And then we're picking up on male reproductive here. And all we're really interested in here is tunica albuginea. Here's the spermatic cord that would be running through the inguinal canal. And here's the vase, the last part of the genital duct sequence, connecting with the urethra at the base of the bladder. And here's the urethra peeking out from this rudimentary prostatic tissue. not very well organized yet in a 4-year-old. So in the adult male, you get much better development here. It's intrapelvic structure, back side of the urinary bladder, left ureter, right ureter, down and into the bottom of the bladder. Hooking over the ureters is another muscular tube here and here. So that's the vase coming from the spermatic cord in the inguinal canal. It's actually the ampulla, which you don't have to know, it's just the widened area for storage. These are now linking with the urethra coming out of the base of the bladder. But then obscuring it is this glandular collar around the urethra. That's the prostate, meaning that which goes before, in this case, the bladder. And that will actually see part of the wall of the urethra comes from the prostate. Why you hear of males getting prostatectomies when this enlarges and now it encroaches on the lumen of the urethra. Spinning blades up in here to cut it away so they can void more easily afterwards. And then you look for the little ears on the back of the bladder. Big ear on the left, smaller ear on the right. These are the seminal vesicles. Connect with the urethra, once again at the base of the bladder. A lot going on the back side of the human urinary bladder, those structures. This I wouldn't use, but it's just to look at the inguinal canal with the spermatic cord inside it. It's a muscular structure. But I'm not going to use that next week at all. More interested in your histological knowledge of that structure. And then the female gross anatomy, massively enlarged here with the cow, ovaries, fallopian tube or oviduct, uterine tube right there, all supported by this very massive ligament on either side, the broad ligament. Got to know its 3 subdivisions. If it's attached to the tube, that's the mesosalpinx. Salpinx for tube. If it's attached and supporting the ovarian tissue, mesovarium. And then the majority of it attached to the side of the uterus. Makes it the mesometrium part of the broad ligament. I will ask you about those subdivided names. Salpinx, ovarium, mesometrium. Don't worry about this. This is just the analogous structure to the vas deferens in the male. Only in the female, it's a vestigial embryonic blood vessel, now helping to support the broad ligament. Don't even worry about the name. And then parts of the uterus with the fundus, the bubble above, the body, isthmus narrows down, lower end going intravaginally as the cervix. The is just the opening of the cervix. That's pretty easy, just naming parts of the uterus. All right. Lateral view of the pelvis showing the bladder up front. Pubic symphysis right there. Female with the uterus right there, cervix right there. And that the P of D is right there for the female. Subtract that in the male, a wider P of D. Lowest point in the pelvis. That's just a lateral view of the interpelvic space. That's most important. Sampling that with aspiration of fluid all the time. All right, enough there. Don't worry about that. Finish up with our male histology. Start with the encapsulating tissue, tunica albuginea, the white layer. Very dense, extremely strong. Where the testis proper is actually quite spherical. But then part of the genital duct sequence hooks around it, all encased in tunica albuginea, which then gives it an ovoid shape overall. So what we have in here are the seminiferous tubules, the germinal tissue, which then send the cells into the straight tubules, part of the genital duct sequence that you should know for next week. They sort of intertwine up here at the superior pole as the rete testis. This is in the diagram that you were assigned in the text. And then you go from inside to outside across this valley. These would be the efferent ducts, the exiting ducts. The E is to exit. And then they coalesce to form the epididymis, which is that C-shaped structure, about 20 meters long, all packed in here. And then coming out the tail is this little translucent line. Just barely see it. That's the muscular tube of the vase, which is now going up inside the spermatic cord, traversing the inguinal canal, heading for the urethra at the base of the bladder. And then in relief, you can see the urethra of the vase, where a vasectomy would be performed. Contraception would cut it, and now those cells can't get to the urethra. So that's the relief on the side there. So if we now take away the tunica, what's left here are all the seminiferous tubules, 700 to 800 feet in each testis, average 1,500 feet overall, adds up to tremendous surface area. It's like a singles tennis court. So when you look at this in the histo, here's all your tubules. I would never have you identify this for anything. Always would magnify it at least a couple hundred more times. Little area like that. And now the wall